Did you know that some supplements that appear to be beneficial can actually be dangerous for people with diabetes? Imagine taking something thinking it will improve your health, but it could end up making your blood sugar control even more complicated. In this video, we will reveal the unexpected effects of supplements such as vitamin E, omega-3, niacin, and even chromium, which many people with diabetes take without knowing the risks. Stay until the end to discover a simple, safe plan of action that can help you make more informed decisions about supplements. And if you haven't signed up yet, click the button below and never miss any more important content about health and well-being. Vitamin E is an essential nutrient with antioxidant properties, which help protect the body's cells from damage caused by free radicals. It is well known for its role in promoting heart health, strengthening the immune system, and keeping skin healthy and youthful. It can be found in foods such as almonds, spinach, sunflower seeds, and avocado, and is often consumed through supplements. For seniors, these benefits can be especially appealing, as many seek ways to improve cardiovascular health and combat the effects of aging. However, when it comes to people with diabetes, the use of vitamin E supplements should be treated with great caution. Although vitamin E has many benefits, it can also cause serious problems if consumed in excess, especially in people already taking blood-thinning medications such as warfarin. Warfarin is used to prevent the formation of blood clots, a common condition in diabetics due to the increased risk of cardiovascular diseases such as heart attack and stroke. Consuming large amounts of vitamin E can make the blood thinner, which can increase the risk of bleeding. Even small cuts can result in complications, with bleeding difficult to stop. Additionally, internal bleeding can occur without any visible signs, which can be fatal. For this reason, it is extremely important that diabetics avoid vitamin E supplements if they are taking blood thinners. It is possible to safely obtain vitamin E from food sources, but when it comes to supplements, medical supervision is essential. Consulting a doctor before starting any type of supplementation is essential to ensure that you are not at risk of serious complications. Did you know that even with the known benefits of certain supplements, such as omega-3 and niacin, they may be harming your glycemic control without you realizing it? If you have diabetes, the last thing you need is more complications. Stay until the end to understand how these supplements can affect your health and what you can do to avoid unnecessary risks. At the end of this video, we will show you a simple and straightforward action plan that could be the key to improving your health without putting your safety at risk. Don't forget to subscribe to the channel and stay up to date with more essential tips for your well-being. Omega-3. Omega-3 is a type of healthy fat found in fish such as salmon, sardines, and mackerel, and is widely recommended for its beneficial effects on cardiovascular health. It helps reduce inflammation in the body and lowers the risk of heart disease. For these reasons, many seniors turn to the use of fish oil supplements in hopes of improving their heart health. For people with diabetes, the question about omega-3 is not so simple, as scientific evidence on the effects of this nutrient on diabetes control is mixed. Some studies suggest that consuming fish rich in omega-3 can even reduce the risk of developing type 2 diabetes, while others do not show significant results in this regard. However, the big challenge lies in the interaction of omega-3 with anticoagulant medications, such as aspirin or warfarin, which are commonly used by diabetics. Omega-3 can intensify the anticoagulant effect of these medications, increasing the risk of bleeding. This is because omega-3s have the ability to thin the blood, which, in conjunction with anticoagulant medications, can cause serious problems such as internal bleeding, which can be difficult to control. Even though omega-3 is beneficial for cardiovascular health, combining it with anticoagulant medications requires caution. If you are taking medications to control your diabetes, it is crucial to talk to your doctor before starting to use omega-3 supplements. In people who do not use anticoagulants, omega-3 can be an excellent option to promote heart health, but always under medical supervision, to ensure that there are no additional health risks. Vitamin C. Vitamin C is widely recognized for its role in strengthening the immune system and for being essential in preventing colds. Many people with diabetes believe it can help control blood sugar levels or even improve insulin sensitivity. However, scientific research does not confirm these expectations. Although vitamin C is important for overall health, it does not have a direct effect on glucose control in people with diabetes. In fact, excessive use of vitamin C, especially through supplements, can be harmful. When consumed in large quantities, vitamin C can interfere with medications used to control diabetes, making it difficult to control blood sugar levels. Furthermore, high doses of vitamin C can cause unpleasant side effects, such as diarrhea and abdominal pain, which can be even more uncomfortable for the elderly. Although vitamin C is important for the protection of cells and the proper functioning of the immune system, it is not recommended to use it in large doses without medical advice. For diabetics, it is essential to consult a doctor before starting to use vitamin C supplements, as this may directly interfere with ongoing treatments. The best way to get vitamin C is through fresh foods, such as oranges, strawberries, kiwi fruit, and green vegetables, such as broccoli and spinach. If a patient is considering the use of supplements, it is essential that they talk to their doctor to ensure that the treatment will not affect the effectiveness of diabetes control and overall health. Niacin. Niacin, also known as vitamin B3, is a common supplement used to improve blood cholesterol levels. This substance is effective in increasing good cholesterol, called HDL, and reducing bad cholesterol, known as LDL, which results in benefits for heart health. For this reason, many people with diabetes consider using niacin as they have a higher risk of developing heart disease. However, an important point to note is that niacin may have an opposite effect on diabetes control. Although niacin is useful for improving cholesterol, it can also increase blood glucose levels. For people with diabetes, this increase in glucose levels can be problematic. Blood sugar control is a major concern in treating the disease, and any factor that interferes with this control can make it more difficult to manage the condition. When niacin raises glucose levels, it can cause frequent spikes in blood sugar, which is harmful to your health. These spikes can, over time, harm the eyes, kidneys, and nerves, areas that are especially vulnerable in people with diabetes. Therefore, before considering the use of niacin, it is essential to talk to a doctor. Your doctor can help you assess whether the supplement is suitable for your health and indicate the best way to include it in your routine if necessary. Using niacin without medical supervision can result in complications for those who already have diabetes, especially due to the effect it can have on blood glucose levels. Chromium is a mineral that can be found in many foods, such as whole grains, fruits, and vegetables. It is widely studied for its potential to improve the body's response to insulin, something that can benefit people with type 2 diabetes. Insulin is responsible for helping to control blood glucose levels, and the idea is that chromium can improve the effectiveness of insulin, making it easier to control blood sugar. However, research on the effects of chromium on diabetes is not yet conclusive. Although there is some evidence that chromium can help increase the body's sensitivity to insulin, there is still no clear consensus in the scientific community about its actual effectiveness. This means that it cannot be said with certainty that chromium has a significant impact on diabetes control. Additionally, chromium can interact with medications commonly used by diabetics, such as insulin and metformin, which can cause a greater risk of hypoglycemia. Hypoglycemia occurs when blood glucose levels drop too low, which can result in symptoms such as dizziness, tremors, mental confusion, and, in more serious cases, even fainting. When a person with diabetes is already taking insulin or metformin, adding chromium to their routine can worsen the situation and lead to serious complications. Therefore, it is extremely important to consult a doctor before starting to use chromium supplements. The doctor will be able to analyze the specific case, assess the risks, and advise you on the best way to deal with the condition. Only a healthcare professional can determine whether chromium is safe for a person and whether it actually has any benefit in controlling diabetes. Although supplements can bring benefits to general health, in the case of people with diabetes, extra care is needed when considering their use. Some supplements, such as vitamin E, omega-3, vitamin C, niacin, and chromium, have the potential to interfere with blood glucose control and even affect the effectiveness of medications used to treat diabetes. Therefore, it is essential that any changes to your health routine, including the use of supplements, be discussed with a doctor. Diabetes control does not depend solely on medication, but involves a complete approach, which includes a healthy diet, regular physical activity, and constant monitoring of glucose levels. To avoid long-term complications and ensure that the decisions made regarding your health are the best, it is important to always have medical supervision. Constant dialogue with healthcare professionals is key to ensuring that the choices you make for diabetes treatment are safe and effective. Only with the guidance of experts will it be possible to make adjustments to your diet, supplements, or medications safely, avoiding complications and improving your quality of life. The health of a person with diabetes must be managed in a careful and informed manner, and medical guidance is always essential in this process. Did you know that using supplements without correct medical advice can put your health at risk, especially if you have diabetes? So, how to make the right choice and not fall into traps? Throughout this video, you've learned about the unexpected effects of certain supplements, but now it's time to understand the ultimate plan of action to ensure you make the safest decisions for your health. Subscribe to the channel so you don't miss any other content that can transform your health and help you control diabetes safely.